Hello, my name is Jake Pearson. I'm one of the first-year orthopedic residents here at Good Samaritan. Thank you for taking the time to listen to this project. We wanted to investigate whether HEMIGARD, a suture augmentation device used for high-tension wound closure, would prove superior to suture alone with regard to the amount of force required for pull-out strength in the cadaver lower extremity. If you look at Figure 1, you can see a picture of the human cadaver lower extremity that was used for our study, both the leg and the foot, as well as the incisions that we would mark out on each cadaver to use for testing. One side of the incision would be used for suture, whereas the other side of the same incision would be used for suture passed through the HEMIGARD augmentation device. The second part of the Figure 1 is a picture of the force gauge used to measure the newtons of force required for pullout, as well as in the right side you can see one of the HEMIGARD devices. Figure 2 is a representation of our data, comparing box plots of both the cadaver leg and foot in both of our groups. You can see there is no statistically significant difference between these two. Figure 3 is a representation of our data if we exclude HEMIGARD device failure. What I mean by HEMIGARD device failure is that several instances we noted failure of the adhesive when we were testing the amount of force required for pullout, or even tearing of the tape itself. If we exclude these numbers for the HEMIGARD device and only looked at the devices that remained intact, Figure 3's box plots are the data we find. There's no difference in the cadaver leg. However, in the cadaver foot, it does appear that HEMIGARD augmentation does require more force for pullout. This could indicate that HEMIGARD may be superior to suture alone in the cadaver lower extremity. Of course, the biggest limitation to our study is the use of cadaveric model instead of living tissue, as well as the number of HEMIGARD failures noted. We would need to investigate more into as to why these failures